recurring lemmas persist after hoof trimming and found 0.5 and 0.5 centimeter wound on lateral claw of the right forelimbs and proceed with wound cleaning. And on the day 2, there is the presence of the bilateral mucoid nasal discharge. However, there is no antibiotic was indicated, and we monitor if there is a systemic sign. So on the day 7, there is a unilateral mucoid nasal discharge, and we 2P in all forelimbs, and we found there is a soft ulcer. So was observed in all 4 limbs, and hoof trimming was done. And also tetracycline was given 20 ml per kg, and through IM for every 3 days. So for updated problem list, and which is the subsoil in all forms, and I also rule out the foot rot, arthritis, and fracture. And for the further plans, we have done the hoof trimming, and for the subsoil, we are going to soak with 10% copper sulfate. So, and on 29 October, Magna appeared not bearing lameness when standing for treatment and during feeding.
So the tentative analysis for this case is sore ulcer. So next, for the problem, for the treatment plan, for the wet-bearing redness grade 2 at right forelimb, the treatment base was wound cleaning at the right. So using the diluted heavy scrub, plus the sterilized saline, and also gauze salt with the iodine. So from the day 1 until present, the indication is to prevent the infection at the wound site and also promote the healing. So second thing we do is giving the oxytetracycline 20 mg per kg, 2.5 ml IM every 3 days. On day 7, day 10, and day 13 is indication as long-acting broad-spectrum antibiotic. So since Mata also has bilateral muconasal discharge, oxytetracycline also indicated to cover the sore ulcer from infection and also the discharge. So for the second problem, subsoil in all 4 limbs, 10% copper sulfate footing was done from day 7 to day 11 and to disinfect and hardening of the hoof. So this is a process of how we done the wound cleaning. First, we flush with the diluted chlorhexidine. After that, we flush with sterilized saline. After that, we dab with the tissue paper to dry. And lastly, we dab with the gauze, salt with iodine, and bandage it. So for the case progression from 25th October to 31 October, so we can see from the 25th October, we notice 0.5 times 0.5 cm of the wound on lateral claw of the right forelimb. On 26, the wound becomes dry and no discharge being observed. On 27, the wound also becomes dry and clean. Next. So from 28 to 30, the wound was dry and clean. However, on the 31st of October, we noticed that there's a presence of the pus in the middle of the sole of lateral claw of right forelimb. So prognosis for this case in our thought is good because we can see there's an improvement on the sore ulcer However, on 31st, we noticed that there's a presence of the pus, but we believe that with the proper management and also if there's and also given of the acetated cycline, in the condition of the matam can be improved and have a good prognosis. So for the client education, we advise to clean and bandage the foot every day and keep the wound dry. And also we need to trim the hoof if necessary. And lastly, keep the pen clean and dry to prevent secondary bacterial infection. So that's all from us. Any question?
Morning, everyone. Remind me if there was any systemic clinical signs observed in this doe?
Good morning, doctor. There is no any systemic sign being observed in this goat.
Okay, can we have a look at your differential? So what makes you think that you would include foot rot, arthritis, or even fracture in this case? What would be the contributing factors or the factors that makes you think other differentials should be included in this case?
Doctor, for the differential diagnosis, actually, first of all, we included all three, like foot rot, arthritis, and fracture. In this case, is based on the weight-bearing lameness spread 2 at the right forelimb. But after we print the foot hoof, and we found that there's no other false smelling, then we also noticed that there's only involvement of the sole ulcer, and there's no interdigital and swelling of the whole hoof. That's why we rule out for the foot rot. And also, there's no crepitus and also discontinuous along the right forelimb. That's why we also rule out the fracture. And there's no warm, swollen, or reddened being upon the palpation. That's why we also rule out the arthritis.
This is just my thoughts, okay? Of course, if it's just based on the weight-bearing lameness, you would include everything, foot rot, arthritis, and fracture. But somehow, if you were to include all of this, other factors should be taken into consideration. If you're talking about foot rot, foot rot is actually like a hurt problem, a flog problem, and taking into consideration that this doe is managed fully intensively, correct? Okay. And there's no change in diet, no change of management whatsoever. So the likeliness of everything else to be one of the differential would not be that significant. Okay? You understand what I'm saying? If it's just based on your weight-bearing lameness, it's okay to include that, but I'm just thinking that foot rot would be some other things could cause foot rot, arthritis, or even fracture. But if it's just based on the weight-bearing lameness, to include that would not be that significant. All right? And what do you think is the factor that could cause this problem in this doe then having sole ulcer or wound?
The doctor will think about it. For the cause of the sole ulcer, in our thoughts, it may be due to the traumatic injury.
Traumatic injury from where?
Maybe there's any puncture or from in the pen that there's a sharp object that this matam has been accidentally stepped on in our thought.
So it has progressed from not okay, but the weight bearing lameness is still there.
Sorry, doctor. The question of the doctor
Is the weight-bearing lameness is still there, or it has improved a bit?
the web bearing is still there, but Matam is improved. The condition of the Matam is improved, but there is still presence of the web bearing.
Okay, thank you.
Thank you, doctor. Any other question?
Hi guys.
Hi, morning,
Mornings.
doctor.
Yeah.
Morning.
What are based on your reading, right? Because I think I did ask you guys to do some reading on lameness and everything in ruminants, right? So, what is the treatment guideline for ulcers in ruminant? Based on your reading, what are the recommendations that we should do?
For treatment, if there is a sole abscesses, so we firstly we need to do is to do the foot trimming, and then we release the pus, and then do the wound cleaning,
Yeah.
and then
So
apply topical. Okay.
okay, that's good. That means you read. So, but in this case, do you think any hoof trimming was done? Which part of the whole hoof trimming should be done? Do you think in this case?
Doctor, based on the reading, if there's a sore ulcer present, the hard horn around the affected area should be
Yeah,
removed.
isn't it? So
Yes.
why didn't I looking at the pictures? It doesn't look like it's been done, right?
We done on
I know you guys trimmed the hoof, right?
yeah.
The
Mm.
horns, but then not on the sole, isn't it?
Yes, okay.
So perhaps we should, isn't it? Right?
Yes.
Yeah, because that's why the pus. I think the pus is already been building up, but we didn't realize. So I think the whole the sole should be trimmed up. Okay, because you need to expose that maybe there's some dirt or something there, so you need to expose that area so that the pus can all come out. Like you have proper drainage, and then we can bandage it up. All right. So what else? What other treatment should be done that you can recommend to further improve this?
Based on our reading,
Yes.
maybe we can supply with the multiple vitamin because one of the article I read, they say the biotin can actually help to improve the hoof condition by stimulate the epidermal cyst.
Supplement of what? Sorry,
Biotin.
Shazana. I think your mic is on, Shazana. Can you switch it off? Thank you. All right, Kangta, can you repeat that again? Sorry, we missed out.
Biotin.
Iodine, is
It's
it?
like vitamin B.
Oh, vitamin B. Okay. And
Yeah.
then the copper. What else can we use besides copper?
Zinc sulfate.
Sorry,
Zinc sulfate.
zinc sulfate.
Yes.
How many percent? You know, if you're gonna tell the client how many percent, like what else can he use besides copper sulfate?
I think for the zinc sulfate we can use 10% of zinc sulfate or 4 to 5% of formalin.
Formalin lagi. What else? You guys did your assignment on this, isn't it? Mesti tahu.
Yes.
What else? What else? I'm sure you must know. Besides copper sulfate, so zinc sulfate and formalin. Other things? Anyone else in the group?
I think we can also give iodine.
Berapa persen? 5 to 10?
Yeah, to go something around that figure. I think that.
Okay. So at least you have to be able to tell your clients so that nanti if you want to advise them, what are the things they can buy. Sometimes they may not be able to get certain chemicals. So at least you can give them other options. Okay. All right. Thank you.
Okay.
Any more question? If not, doctor is there, we can move to next case.
Yes, please.
Okay, thank you, doctor.
Thank you.
Thank you.
Good morning to everyone present here today. So we are from group rotation 14, going to present a case about chronic diarrhea in a friesian sahiwal calf. So this is T107, is a 8-month-old friesian sahiwal male bovine weighing around 70 kg with body condition score of 1/5. He was managed in a free grazing environment. So for the history, on the 27th of September 2021, T107 has suspected to have umbilical hernia, so he was sent to UVH for herniorrhaphy. However, the next day, he developed score 1 diarrhea, and on the 1st of October 2021, herniorrhaphy and herniaplasty was done. However, the diarrhea is still persist. For the physical examination, the TPR were within normal limits, and the T107 is quiet, alert, and responsive. Pale mucous membrane with CRT 3 seconds, clear langsam. Skin tan is less than 2 seconds with sunken eyes. And rumor cycle is 1 cycle in 1 minute. And he also had a focal erythema at the lateral left forelimb and hind limb, and also wound at the proximal to the coronet. And he also has a presence of tick, and the diarrhea with fecal score 1 was also observed. So this is the picture showing fecal score 1 of T107, and from this time on, choline pectin was prescribed. And so we come up with the problem list. For problem number 1 is score 1 diarrhea with differential diagnosis of infectious causes such as parasite, may be caused by coccidiosis, Amelia species, strong gut infectious infestations such as Trichostrongylus species, and esophagostomum. And for bacteria, might be Johne's disease, Campylobacteriosis, and Salmonellosis. And as for virus, might be caused by BVDV. And for non-infectious causes, might be due to changes in the diet that cause nutritional scour. And the plan was to do CBC and serum biochemistry, fecal culture and AST, McMaster fecal egg count, and fecal smear and staining using Ziehl-Neelsen stain. And for the second problem list is pale mucous membrane. may be caused by tick infestation, Bufillus microplus, blood parasites such as anaplasmosis, babesiosis, and trypanosomiasis, and also might be caused by Haemonchus contortus infestation. And the plan was to do direct wet mount, thin blood film hematocrit concentration technique, and McMaster fecal egg count. And as for 7% dehydration, may be due to problem number 1, and the plan was to do IV fluid administration. So on that day, direct wet mount HCT and GIMSA stain blood film shows negative result. And also for modified McMaster method, for Strongyle, we obtain 400 egg per gram, and for Coccidia, we obtain the result of 5,350 oocysts per gram.
So complete blood count and serum biochemistry was done on 18 October. Hemogram results show the animal has anemia. Leukogram results show a no significant finding. From biochemistry, the animal has hypocalcemia due to the malnutrition. Zinc stain was done on 20 October and the result was negative. However, we cannot rule out Johnny disease due to its poor sensitivity and specificity. And to confirm this diagnosis, we can opt for bacterial culture, which is the gold standard, and PCR. The result for fecal culture and AST still pending. For updated problem list, for problem score 1 diarrhea, we can only rule out stronger infestation. So problem anemia, we can rule out blood parasite and Haemonchus contortus infestation. Progression on day 25 post-surgery, which is on 21 October 2021, the animal become weak and recumbent after walking, and we can see sunken eyes. For treatment, for problem coccidiosis, sulfidimidine 0.1 ml per kg, 35 ml was given through subcut from day 9 to day 11 for 3 days as coccidiosis types. And diarrhea, and next diarrhea, qualopectin 30 ml per 25 kg, 90 ml was given through oral if diarrhea was observed as a gastrointestinal protectant. Phoneximeglomin 1.1 mg per kg was given through IM, SID, and meloxicam 0.2 mg per kg SID was given through subcut as anti-inflammatory and analgesics. For recumbent and weakness, Hemoplus 3 ml IM SID were given on day 25 as iron and vitamin B supplement. For 7% dehydration, detected ringer solution 350 ml per site through subcut and 40 ml per kg per day through IV was given on day 25. For subcut was given day 25 and day 26 to correct the dehydration due to diarrhea. This is progression for fecal score, and the fecal score always between score 2 and 3, and it's only become normal after qualipectin was given. For this case, the prognosis is poor because the body condition score is 1/5 and the animal look emaciated and diarrhea still persists, and chronic diarrhea can cause inflammation to the intestine and lead to protein losing enteropathy and animal unable to absorb nutrients. For prior education, the infected cattle need to be isolated from the herd, and we need to close monitoring on T107 based on the animal position, body temperature, and fecal score. And good nutrition and hygienic environment need to be provided for optimal recovery, and the hair need to be soaked with water to promote water uptake by the animal. That's all from us. Thank you.
Hello, good morning. Hello?
Morning, doctor.
Morning, doctor.
Yeah. I have a question. How old is the calf?
The calf is around 6 to 8 months old.
6 to 8 months old. Other than Ionis, what are the differential for bacterial diarrhea in a 6 months old calf?
Doctor, this is the differential diagnosis that we have came out.
I cannot see the slide because I'm using the phone.
Oh, okay. So
Yeah.
for bacteria other than jaundice disease, we have campylobacteriosis and salmonellosis.
How about colibacillosis?
Yes, doctor, we can. Yes.
How about treatment for bacterial diarrhea? Did you give antibiotic?
Doctor, we did give antibiotic, which is after the surgery for 3 to 5 days. However, we observed that the diarrhea is still not resolved. So at the meantime, we were doing culture and also ST. So from that time we stopped the antibiotic.
But how about the animal? Is it fever? Does it have fever or anything like that?
They never have fever.
Okay. How about the hypocalcemia? Did you treat the hypocalcemia and anemia?
Doctor, for anemia, we did give hemoplast. However, for the hypocalcemia, we didn't treat because we suspect because the value is not significant.
Any second hemo and hemogram and serum biochemistry? To see the progress of the anemia and also hypocalcemia.
The hypocalcemia was the latest result from the CBC and serum biochemistry.
Okay, so is it in your? Will it be another serum biochemistry to see the progress? How is it doing now?
I think we should do another serum biochemistry test.
Mhm. How about the cough now? Is it already standing, walking around, or is it still recumbent?
So for this calf, doctor, sometimes we can see the calf standing by its own, but sometimes we need to assist him to stand. So far, the appetite is doing good, appetite good, and then sometimes we force drinking water.
How about the dehydration? Has it been resolved?
So doctor, for the skin tan, it's within normal range, which is less than 2 seconds, but the sunken eye has been reduced from the previous episode.
Okay, all right. So now it's monitoring. Okay, all right. Thank you very much.
Thank you,
Hi
doctor.
guys, maybe you can explain a little bit about the calf's behavior. Does it drink on its own or it has to be bottled? You know, you have to explain. Did you explain that?
No, doctor.
So maybe perhaps you should explain a little bit, isn't it, on the behavior of the calf?
So basically the calf is always in quiet, alert and responsive. And then every morning we notice the calf always in a recumbent in a sternal position. So we have to assist the calf to stand. And also the calf is unable to, don't want to drink on his own. So we bottle feed the calf through the bottle.
Yeah, that's from
Around 4 meals.
4 meals. 4 meals.
4 liters, sorry.
Every day, isn't it? From day one, he was admitted, isn't it?
Yes.
And then going back to your differential diagnosis, is there a bacteria called Johne's disease?
Sorry, doctor, it should be paratuberculosis mycobacterium.
Ah.
Yeah.
So based on your reading, what other treatment can we do for this guy besides, sending him for postmortem? Isn't it? Because his condition is quite bad, not improving, right? What other treatment would you suggest that we can do?
Hi, doctor. From our reading, maybe before we send him to postmortem, we should wait for the bactericulture and AST results. So maybe we can try to give another antibiotics that's more narrow spectrum to the cattle, and then maybe we will have to see how it goes after giving him antibiotic after that.
You think antibiotic is the only way of treatment? What other things we can do? What are the things from your reading? Why wasn't transformation done in this calf? Transformation would be good, isn't it? What do you think?
Yes, doctor, we think it's a good choice to do transfoundation in this case.
So why didn't we do it? Did you guys ask? I mean, next time if you have any ideas, like if you have any suggestions, you could suggest, isn't it? And perhaps then we can discuss further. I think we wanted to do transformation, but because our animals are all post LSD, and we don't have a good candidate actually. All right. So because with the other two, we just had an LSD outbreak, isn't it? So that's why we didn't opt for the Chuchu DBKL, and then the big mummy is not a good candidate. But I think to do transformation would be good also. Okay, for this case, after a long diarrhea situation. I thought you guys are supposed to read out one. What other things that you can suggest for treatment for this girl, for this boy?
We can just give supportive therapy since we still haven't get the primary cause for this condition.
I think you guys can do better. Wait, there's a question by Dr. Azlina. Can you answer that?
The Strongal count is 400. Yes, and also due to the management of the calf is extensively managed, so we think the Strongal count is not significant.
Did you answer Dr. Azlina's question? Her question is how to diagnose if you suspect it's Toxocara. And to add on to that question, has this calf been dewormed before?
Hi, doctor. From what we know from the history, there is no deworm. The calf is not dewormed before.
Are you sure or not? I think the calf has been dewormed twice. Okay, once ivermectin in their farm, and then when they came to the wards, right? So how would you diagnose if it's suspected Toxocara?
Doctor, for Toxocara, we can use a master fecal count. And after we do, and the stronger is not significant, so we can rule out Toxocara.
Is there any more questions? If not, can we move on to the next case?
Yes, please. Thank you.
Thank you so much, Doctor.
Assalamualaikum and a very good morning. We are from group rotation 14 and we will be presenting an exotic case entitled Carapace fracture in chelonian. This is Wilbur, a chelonian tortoise bred with a color of brown-green and age 1 year old. Wilbur is a male tortoise weighing 0.35 kilograms. As for the history, on the 26th of October, sorry, doctor, I think we have the wrong slide. Just a moment. Okay, so continuing with our presentation. So as for the history, on the 26th of October, Wilbur went through a traumatic injury as his owner accidentally fell down and sit on him. And after that, Wilbur was presented to private vet and was given meloxicam at 0.2 mg per kg and was referred to UVH on the next day. Upon physical examination, the dehydration status is 7% and the cracked right cranial carapace was observed with exposed lung, and we can also see swollen left eye. This is a diagram of the left one is the carapace and the right one is the plastron for better understanding. So as we can see, the carapace, there is a fracture at the right cranial and also the left cranial. And as for the plastron at the right diagram, we can see fracture at the left cranial of the plastron. Next. So we came up with problem list. The first problem is carapace shell fracture with a definitive diagnosis of traumatic injury, and the plan was to do radiograph and shell fracture repair. As for the second problem, swollen left eye with definitive diagnosis of traumatic injury, the plan was to do eye cleaning and also anti-inflammatory and antibiotic administration. The third problem is 7% dehydration with definitive diagnosis of exposed body cavity due to problem number 1. And the plan was to do intracellular or subcutaneous fluid with rate of 7% plus 1 ml per kg per day for maintenance. And the last problem is lung injury, which is due to traumatic injury, and the plan was to do radiograph. Radiograph was done on the same day Wilbur was presented to UVH. So this is the dorsal-ventral view. The radiological findings for this view is total discontinuity of the carapace at the anterior right, and also there is the partial discontinuity of the carapace at the anterior left with radiological diagnosis of carapace fracture.
So moving on to the anterior posterior view of the radiograph, there is discontinuity of the carapace with the radiological diagnosis of carapace fracture, soft tissue opacity ventral to the right carapace with the radiological diagnosis of right lung collapse. So we proceed to the wound cleaning and epoxy application. So before the fracture repair, tramadol 2 mg per kg subcut, intracellular fluid therapy NSCL 5 ml per kg and meloxicam 0.2 mg per kg subcut was given. Fracture wound was flushed with diluted chlorhexidine with the ratio of 1 to 20 and normal saline until it's clean and no blood oozing out. So the fracture were aligned and opposed. Superglue, the clear resin epoxy, was applied on the fracture carapace. Nickel eye drop was applied on the left swollen eye. So for the post-operative treatments, for the problem list number 1, carapace shell fracture, meloxicam 0.2 mg per kg subcut SID was given for 5 days as NSAID to reduce the inflammations. Tramadol 2 mg per kg subcut BID was given for 3 days as pain management. Gentamicin 2.5 mg per kg intradermal was given SID for 1 day as prophylactic antibiotic to prevent infection. For 7% dehydration, lactated ringer solution 5 ml per kg subcut BID was given for 3 days to correct the dehydration. For the swollen eyes, the nickel eye drop was given TID for 3 days as topical antibiotic to treat the eye infection. So for the post-operative management, force feed the tortoise using the syringe, maintain ideal temperature range from 26 degrees Celsius to 38 degrees Celsius in incubator to maintain the metabolism of the animal, ensure the wound site is kept clean and monitor for evidence of wound breakdowns, provide critical care diets through the e-tube. So for the client instructions, ensure the wound hygiene and monitor any evidence of wound breakdown. Provide excellent husbandry condition, such as diet and temperature. Revisit for follow-up every 3 months, except if got complication, need revisit immediately. Follow treatment as indicated by the vet. Avoid immersions of the tortoise into the water, dry docking in the first few weeks of shell healing. Provide soft bedding to avoid plastral pressure sore during dry docking. So that's all from us. Thank you. Any questions? Okay, thank you, Dr. Azlan. We take note of that.
Hello and good morning, Dr. Gaya. So the dehydration status in tortoise was assessed through the eyes, through the sunken eyes. So from what we observe, Wilbur have a 7% dehydration through his eyes. Good morning, Fratelli. So for your question, how epoxy application was done, um, in, and how precaution was taken to so that the glue was not going through the thoracic cavity. So first, before we apply the glue, we must align first the the thread shell so that it become in normal position, and we only apply the epoxy on the surface which is on the carapace, gently, so gently and slowly, so that it will not seep through into the thoracic cavity. And also before we apply the epoxy was mixed thoroughly until it reaches a viscous consistency, and then we apply the carapace. Hello. For
Various question. May I know what is the plan for right lung collapse and what is the process for this case? So, in this case, the lung collapse in further will slowly become normal. However, in the time for 30 days, if the other lung collapse, the other lung will have to adapt to the new condition. So in this case, we think that and then the disease is still able to breathe on and in this case, we think that the prognosis is good. Given that the fracture is being taken care of properly, and also to avoid further infection.
Hi. Since meloxicam has also have analgesic value, but why we still need to give tramadol? Because Carapace fracture is quite is considered like moderate to severe pain. So if meloxicam alone is not enough because it's only 100 amount of pain, so we given tramadol again for this case. So to update everyone from the Iceland, dehydration should assess the overall signs such as history of weight loss, include the hemorrhage as observed on the towel, the brightness of the mucous membrane, and the level of sunset eye.
So good morning, Dr. Azlan. So Dr. Azlan explained what are the analysis that we can do to fix this problem. So we can consider fiberglass and also application of the cable type to align the structure of the carapace.